Hello everyone, welcome to Mental Health and Science with Birabi Enock Francis. In today's video, we are going to talk about the frequently asked questions. For example, everyone is mentally sick, but the degree of mental illness differs. Every mental health worker is mentally sick. Is that true? So let us watch until the end and you'll get the right information so that you can share with our communities. Thank you.
I'm again to meet you all. This is Mental Health and Science with Birabi Enock Francis, a psychiatric clinical officer. I, the host today, I am Olo Joel, a medical clinical officer. So we are going to be handling a few questions that are very common in our society, and yet people don't really ask, but it is circulating. Our mental health expert here today will be giving us a little bit of those answers. You're most welcome.
Thank you, sir.
Please tell the viewers about yourself.
Okay. Yes, as Mr. Joel has told you, my name is Birabi Enock Francis. I am a psychiatric clinical officer, or you can call me a mental health expert, but that is the level that I am. But I manage people with mental health issues, and they range from different things. Okay?
Yeah.
Yeah.
Thank you very much.
Different things, and the people behave different.
You're most welcome.
Thank you so much.
Mental health is a very significant part of our health, and yet people may underlook it. Like, for example, I hear, okay, a question like, everyone is mad. So does that necessarily mean we don't have to treat anyone, or everyone is mad? What is that?
Okay. First of all, I want to say that we don't use such words because we are trying so much to reduce the stigma. We don't have mad people. Okay? We have people who are mentally sick, and that's why we have to end the stigma. As long as you have this head, you can also at one point you were a potential candidate to mental.
Oh, we don't have mad people.
We don't have mad people.
So who's the mad person? How is mad different from mentally ill?
Okay. The world where we are in now, we are trying to look for terms that we don't stigmatize our people.
Yeah.
Because you may find this is a parent, someone who is working in the school, someone who is taking care of the children, and imagine someone's being called mad. It is in front of your children. So it is something which is stigmatizing, and it makes people not to seek for what? For support in the hospitals.
Okay. Okay, so thank you. So you were saying that we don't have to use the word mad. So you're saying that everyone could be mentally ill if we don't use mad. So is everyone mentally ill?
Okay. Yeah, like not everyone is mentally ill, because as you have said, people say that everyone is mentally sick. Okay. And also I've heard where people say that the degree differs.
Yeah.
Yeah. So in mental health, we have different things that you have to know, and we use what we call there is what the criteria for you to be diagnosed with a mental problem. One of them is that we have around 3 of them. One of them is that there is a set of signs and symptoms. Okay, so if in case maybe we want to diagnose with depression, you must have 4 symptoms. One of them is that you must be excessively sad, and plus others.
Yeah.
Okay. So in most cases, when someone has a mental problem, like has one symptom, sometimes you look in our criteria, doesn't follow the criteria. Maybe you have been sad for only 1 day.
Yeah.
Doesn't mean that you are having depression. Then another thing that we look at is the time frame. How long have these signs and symptoms been? Okay, like for depression, this sign must have been there for at least 2 weeks. Okay, Then also the third one is look at the cultural context where the person is coming from. Okay, so if we see someone from Karamoja is walking naked, like on the streets, can we say that this person is mentally sick?
No.
Okay,
Their cultures
in
like
their
that.
culture it is normal.
Yeah.
Okay,
Yeah.
but when we see you moving in a place naked, then we shall say, this is abnormal. So in other words, mental illness is the abnormal. Those are the abnormal behaviors. They call it the abnormal psychology. Okay. So when we base on those things, then we look at, as these things affected your functionality. Are you no longer performing the obligations, the duties that you're supposed to do at home? Are you still supporting your family or not? Okay?
Yeah.
So if in case we find those things have not affected you, then you are not mentally sick. You can be hearing, sometimes you find people talking alone. Yeah? Someone is walking on the way and is talking alone. Okay?
Yeah.
So it has only one what? Sign and what? Symptom. So that one doesn't qualify you to be mentally what? Mentally sick.
Okay.
So I think people, when they look at it, that's where they say the degree differs, which is not right.
Okay. Yeah. Okay. Thank you. What about now these people who go on and running on streets? These are now mentally ill people.
Yes.
Okay. How can we help them? Because the society thinks they shouldn't be part of them.
Okay.
Yeah.
Yeah, these people are part of the society. The way to help them is to, like when you are mentally sick, it's not like someone who is having malaria that you can feel some pain and what, then you come to the hospital. But people who are normal, they see the abnormal behaviors in you. Okay, then they what? They bring you to the facility for treatment. But in most cases, these people are ignored. That's why you find them moving up and down. Okay?
Yeah.
Then one important point that you have to know is that not those only who are moving on the rubbish pits are the only mentally sick people. I can be very smart like this, but it is the brain that is sick. The mind is sick. Okay? So let us not look at only people who are walking on the streets, but there are those people who are smartly dressed, but they are sick. Their mind is what? Is sick. So when you have them, bring them to the hospital.
You know, part of me fears mental health. As I fear so very much these mental ill people, because they can easily stone you. They can easily do anything. What other thing that I hear people? I mean, we do not want to be around them because they are not so social. Okay. Now, my question here is there a chance that you can date a mentally ill person?
Okay. First of all, if you have not come across a mental patient, because we have different types of mental problems, you may find one who can like associating with you so much. Yeah? Likes to be with you. Okay? So you are talking about the marriage. You don't want to associate, but we have, as I've said, we have different types of mental illness. Yeah, dating a mental health patient, it is not wrong. Okay?
Really?
You really love the person. These are people like you and me. Okay?
Yeah.
But it's the mind that is what? Is sick.
So we need,
So what is hard to dating?
okay.
Eh.
Well, that's fine then. I don't know. I'll try to work on that. Personal, I fear. Personal, I fear. How about in your line of work that side? Still, people believe that even those people who work on mentally ill patients, okay, are also mentally ill. Like, how can you work on me? Because you also have to be part of what? Is that true? To what extent is that true anyway?
Okay, people have different things, but these are the beliefs that we are trying to teach our people it is okay to marry somebody who is mentally sick, because as long as you support them, they get their treatment, they become fine. Okay. Then on the side of talking about, they always say that the mentally sick, like as you have said, the mental health professionals are also mentally sick.
Yeah.
Okay. Let's go, like for example, you have a child at home. You have a 5-year-old. Okay. You want to communicate with your baby. Okay. He's 2 years or 2 years old. Are you going to communicate to that child like a big person or as a baby?
Like a baby, yeah?
Okay. Say, let's say example, you are talking to the baby right now, the baby is in front of you. What will you say?
What would I say?
Hey.
I don't know.
Okay.
But
like you want to greet the baby, how will you greet, and how will you talk to the baby?
okay, I would lower my tone a little bit and put myself in her probably.
Can you sample us a bit?
Be like, hello, how are you, young kid? You're fine? Maybe.
Okay. So the same thing with mental patients. Like when you are talking with a baby, you have to be like also a baby. Okay, to get information from what? From them. So when you are talking to a young baby like as a mature adult, you will not get any information. Okay? So a mental patient, when he comes to you, of course their mind, they are out of their mind. So they will be talking things that are not connected. Someone says, yes, I studied with President Museveni.
Yeah.
Yes. When we were with him in the bush, we studied with him, and also, okay, you studied with President Museveni. Okay. When was that? Which year? And you follow this conversation.
You try to be part of the...
Yeah, but behind our mind, we are getting what we call history. We want to find out which type of mental problem that this person have. Okay?
Yeah.
So when someone comes in that version, you go with that version. Say, I have the most expensive TV. You say, okay, how much did you buy that one? Okay?
Yeah.
You worked with Trump? Yes. Okay, how are the children of Trump? Okay?
Yeah.
Yes, how are the children? Then they start giving you information, blah, blah, blah.
So, okay.
But also when you are dealing with a depressed patient, you will not be happy. Because they say, now the husband now left me. I had all my 1 million, the man stole and ran with it, and all those other kind of things. So also that time now you have to go according to that tone.
Okay.
So mostly people, the public, can say that now that is how they take us. When sometimes we are behaving like that, they mistake it. But of course for us, we are behaving in such a way that we want to get the information from the patient. So you find them saying, we are mentally sick.
Okay. Well, from my village where I come from, we have a little bit of a problem. There is this belief that there was a young man who suddenly had this mental illness, and people believe that he was bewitched. Is that true? Could that be true?
Okay, like in our societies we have a belief system. Okay, those beliefs can shape us, who we are. Okay, we don't disagree with those beliefs, because those beliefs also sometimes they have shaped our life. Okay, we believe as mental health professionals, we believe witchcraft is there. Yeah, we believe those things are there in society, but also mental illness is there, and mental illness is not caused by witchcraft.
It's
Okay?
not.
It's not caused by witchcraft. There are many other factors. That's why in our management, there is a method where we call bio-psycho, like social spiritual model. Like bio, we are talking about drugs, we give medication. The psychological, we are
Counseling.
the counseling part of it. Then the other side, the spiritual part, is that if you believe in certain kind of religion, we allow your pastors to come and pray for you. So if there are demons as well, you can take your medication. As you are what? We are praying for you.
Okay? So anyway, what is the difference? How would you tell this one is This one. Okay, what's the difference between witchcraft and mental illness?
Okay. So mental illness has its signs and symptoms, and is a gradual thing. It does not just happen abruptly. Now from nowhere you just start becoming abnormal. Okay.
Yeah.
Mental illness is a gradual process. You may find this person has been going through a lot of stress. These people have been stressing with him, and then since this person cannot handle the stress, there are other factors. Maybe has lost someone. You find this person breaking down. Like as we said, it has signs and symptoms. It has a kind time frame. Okay, if you are to be depressed, if to be having depression, you have to have gone a period of 2 weeks. And we are saying you must have at least 5 what? Symptoms.
Yeah.
Okay? Not just from nowhere you start shouting, blah, 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 blah. Then we said your matter is you have to. Okay?
Okay. Now, if someone develops a mental illness in our home, I fear that we would not like to share food with this person. And this is still happening also in the villages, in the societies around there, that when someone is mentally ill, you can't even share food with them. Can you really share food with a mentally ill person?
Yeah, mentally sick people are like us, and there is no, you cannot get mental illness through sharing food. Okay? Because mental illness has its own factors which cause. Some of them are inborn, some of them are environmental, some of them are psychological, like substance abuse. Someone can be abusing substances and all those other things. Then it does what? It gets the mental illness. Okay? So eating on the same plate as that individual cannot make you to get mental what? Mental illness. So when you have such kind of people in the society,
It is okay to...
you share the food with them because you want them to get better. Okay? Yes. That we call it psychosocial support. You encourage them. If they are lacking medication, you give them medication. Okay? That one helps them to heal faster. But when you isolate them, you don't want to talk to them, this will take long to get better.
But you know that is a very big challenge. Could be easy to say and maybe just think about theoretically. Because even touching a mentally ill person, we fear to touch them as though it could also, as though we could also contract the disease.
That one you should stop it. Yeah, even I know there are some who are violent, but in our training we are trained that when we are our sitting arrangement, when you are clerking your patient or you are assessing your patient, you must sit near anesthesia. Like you have to sit near a doorway.
Why?
Yeah, because in case this person becomes violent, you escape, you take off. So in our setting, when we are arranging the seats, you have to sit near a door. Okay?
Yeah.
So that or a window whereby you can escape in case the man is violent. Okay?
Oh yeah.
Yeah, but associating with those people is first of all they need you to listen to them. When you listen to them, you give them your ears. Those people can give you attention when you say, okay, let me also talk. They can listen to you and understand, and you give them instruction.
Yeah.
They understand.
All right. Thank you very much, viewers. Thank you very much for being with us and watching this. There are so many questions I know that are out there. We may not be able to exhaust all of them, but in case you have a few of them, you can drop it in the comment section. We'll be really glad to see them and try to come back here and answer your questions. Thank you very much for sharing your heart with the viewers today.
Thank you so much for your time. The viewers, thank you so much for listening to us. And in case you have any question, as we have said, please send it to us so that we can still answer your questions related to mental health. we are ready to answer them. Okay, so let us, if you have these people outside, let us take them for treatment. Okay, there are so many hospitals that are offering mental health services. There is no need for us to stigmatize that this one is mad. You say they are mental sick, and at any time also you can get mental illness.
All right, thank you very much. See you again. Thank you very much once again, our dear viewers. We are very happy to share with you from our heart with our expert on mental health, and we are really hoping that with this program we'll be able to give you a little insight on mental health. We are please requesting that subscribe, support us, let's support one another. Thank you all.